Today we're going to be talking about the bony exam in the body. We'll start with the spine. So the first thing that you need to do, normally babies are lying on their back, roll the babies over to one side and make sure that the spine is complete all the way down and that there are no curvatures to one side or the other. Generally, babies are kind of in a fetal position. So their spines are kind of rounded out like that, all the vertebral bodies. So that's okay if it's kind of rounded backwards. We just don't want the spine itself kind of making an S shape like this. Get used to feeling what the tone is like of the baby. So again, we use the word tone when we talk about that innate stiffness or the muscle strength of a baby. So if a baby has really low tone, then they're really floppy. If they're really high tone, then they can be really stiff. One of the most effective ways to check for trunkle tone is to put the baby's belly on the palm of your hand. A normal full-term baby will be able to kind of bring up their head a little bit and be able to kick up their legs a bit. If a baby has really decreased tone, then basically they'll kind of flop over in an inverted U shape. So this would indicate really hypertonic baby or a baby with decreased tone. Going back to examining the spine, make sure that you check in the sacral area that there are no defects. So the sacral area is like right at the bottom of the spine, right above the gluteal cleft. So right above the cleft of the buttocks. There can be abnormalities in the skin there. So it could be just really hairy. All babies are a little bit hairy there, and a lot of that is just kind of genetic from their parents. But if there's like a really weird patch of hair there, there could be like a big dimple, like a big defect in the skin, and you literally can't even see the base of that dimple. There could just flat out be a hole there, and you actually see fluid coming out. Obviously, all of those signs are very concerning, that there could be some abnormal development with the spinal cord underneath it. So these are all basically like a neural tube defect. After examining the spine, take a good look at all the extremities. So full-term babies are normally kind of in a flex position with like bent elbows and bent knees. I've said this a million times before, but you can tell so much about a baby by just looking at them without touching them. And a baby normally will kind of, like I said, be in this flex position and will have occasional movements which are generally symmetric and are nice and smooth. They're not going to be kind of jerky movement. Then make sure that you actually count all the fingers and toes. I still do this every time. It is so easy to miss a digit. And separate all the different fingers to make sure that there isn't any webbing between them. Sometimes they're completely connected, the two different digits, and this is called syndactyly. You would be surprised by how often babies are actually born with an extra digit. So normally it's kind of right on the outside like this, and it can be like a full digit, or it could just be like a little skin tag. Again, if they do have an extra digit, this is nearly always genetic. So either mommy or daddy or somebody in the family had an extra digit too. A very important part of the newborn exam is checking for developmental hip dysplasia. This is where the head of the femur, so the leg bone, is not developing properly within the hip or within the pelvis. So it kind of slips out a little bit. If this continues for a long time, then the kids can have very severe problems in the future. So if it is slightly dislocated when babies are born, we want to catch it as soon as possible. One of the ways that we can see this is by looking at the gluteal fold. So like looking at the creases on the baby's bottom. If they're slightly asymmetrical, then that could imply that one of the bones is kind of slightly out of its place. But the more common ways that we check for developmental hip dysplasia is we put our thumbs on the baby's hips and then literally abduct or turn their hips outwards, turn their femurs outwards so that we can feel the femurs kind of opening up within that joint. If there is the propensity for a dislocation, we'll feel it kind of click. If it's actually dislocated, then we'll feel it go clunk as it's literally clicking out of the joint. Both of these things need to be followed very carefully. There are special harnesses that babies can be put into that will encourage that joint to develop completely normally. So it's important that's caught early. You would also be surprised by how often babies are born with fractures or like literally broken bones. So the most common fractures are the collarbones or the clavicles. So make sure after every baby is born that you feel your fingers all along their clavicles to make sure there aren't any bumps or separations there. But honestly, just about any bone of the extremity can also be fractured during the delivery process. So as you're looking at all the arms and the legs, make sure that you're not missing any abnormal angulations or anything like that. Okay, remember to like this video and then go watch the next video on the cardiac and the respiratory system.